Good morning, guys. I hope we're all sparkly. 5:30 gym session done. Chest day. My favourite day. No, it's not. It used to be, obviously, when I was looking in the mirror flexing. But it's about form and function now. Remember, we're upright, so work more on your posterior chain than your anterior chain. I've been to the sea with Her Royal Highness. We've had a sea dip. An amazing experience. It's always an amazing experience. You can take something different away from every single time because it's always different. I've had a sauna. Scorchio. I am feeling pretty chill. But I thought I'd do a quick video because it's time for a video. Nobody cares, work harder. So if you're like me, you've loved excess. I'm a fan of excess. And when I was young and dumb and full of you know what, I thought I was invincible. But we're not, are we? I burnt the candle at both ends. I worked really hard in the week to party all weekend. Engaging in excess, which ultimately caused harm, which is disappointing, isn't it? So when you go through your 20s and you then turn to 30s, you go, well, I can't do that anymore. So I'm going to start doing triathlons. I'm going to start looking after my health. And because we're fans of excess, we take things to extremes because extremes are great. But what's life all about? Balance. So disappointingly, you've got low testosterone, perhaps as a result of previous endeavors, self-destructive behaviors, or perhaps because of just doing too much. Because paradoxically, when we see guys with normal body weight who have been morbidly obese, it's actually that massive change, that massive exogenous stress or endogenous stress that they've placed on themselves that's resulted in them having low testosterone. How life is so unfair, isn't it? So when you present with your symptoms of low testosterone, obviously they include low mood, anxiety, tiredness, brain fog, low libido. So you want to correct all of these things, don't you? Of course. So you're going to go on testosterone replacement therapy, and that's going to be that magical cure. So, as you guys know, we subscribe to Microdosing TRT, using the minimum effective dose in the correct way to achieve the desired outcome, stable male androgen levels. So, we want to use the minimum effective dose. Well, why do we want to do that? Because I've struggled with all these negative symptoms. Surely I want to have the opposite of tiredness. Lots of energy, lots of libido. I want to be a member of Mensa. TRT is not going to make you a member of Mensa unless you were a member of Mensa before. It's just going to allow for clarity of thought and hopefully give you the drive and determination to do what you need to do. So why can't we have more? Why can't we have excess? Because excess sounds great, doesn't it? Because that's what we've been fans of before. Because life is all about what? Balance. Too much energy. What does that mean? You're not going to sleep, are you, if you're too wired? If you've got too much mental clarity, again, poor sleep, too much libido. Now, what's libido? Libido is incredibly complicated. So it's trivial to say, raise your testosterone to just improve your libido, and your libido is going to be high all the time. That's absurd, isn't it? I mean, when you were 16, yeah, you were a randy goat boy. But the reality is you now have responsibilities. You perhaps have a family, you have a business that you have to run. So we don't want to be horny goat boy all the time. Well, we do, but we can't. So having a libido that will be high in the appropriate time. And as we said before, we're physical beings in a world of psychological stress. So when you turn into more of a parasympathetic state, you're likely to have a libido, or you should have a libido in the right circumstances. And again, sympathetic stress, parasympathetic rest, relaxation. So when guys complain about low libido, I say, how's your life? Stressed, stress. This happens, that happened. Well, you're not supposed to have a libido. How is it on the weekend or when you're on holiday? Oh, it's great then. Well, the issue is not the testosterone then, is it? It's the stress in your life. And again, we see testosterone as a cure-all, fix-all, but it's not, is it? It's merely the foundation to allow you to fix yourself, and it can be that necessary catalyst. So again, minimum effective dose, not maximum effective dose, because ultimately, if you raise things to super physiological, as in above where your physiology, how your body functions, wants to be, and body survives on what? Balance, contrast. You must have contrast to establish harmony. Yin yang, baby. Literally, that is the secret to life. So you're going to have negative consequences from being too high, aren't you? So outside of the psychological things, the disappointment in not being able to be Randy Goat Boy all day, every day, you're going to be calm and considered. And that's what we've said before, isn't it? Testosterone is the calming hormone. And again, it's balancing out against all those excitatory neurotransmitters and cortisol. So if the body survives on the concept of balance and you've got the minimum effective dose, you've got the correct dose. If you've got the maximum effective dose, you actually haven't got an effective dose, have you? Because the body survives on what? Balance. So massive testosterone is going to inhibit cortico-releasing hormone or cortico-releasing factor, and you get low cortisol. And rather than having a nice balance between the two, you're going to have excess excitatory neurotransmitters. And that doesn't feel very good, does it? It actually manifests as anxiety. So we really don't want to have the maximum effective dose, because too much testosterone increases your metabolic rate and demand. So you're going to have a high blood pressure and put more strain on your cardiovascular system. So we know with normal testosterone levels, there's no increased of cardiovascular problems. But obviously with high testosterone, you are going to have consequences. What's it all about? Balance. So what else? You're also going to have issues. Oh, that's going to delay, then I was going to shut down. You're also going to have issues with raised hematocrit. Now, there's a certain group of people that say you don't have to worry about raised hematocrit because of a certain paper. Well, it's logical, isn't it? You raise the red blood cell count to above where your physiology wants it to be. It's going to increase the concentration of red blood cells, which means your thick blood is going to cause harm, because it's going to cause the heart to have to work hard, and the lining of the blood vessel is going to be compromised as a result. You know, increased platelet aggregation. This isn't rocket science, is it? So again, your lipids as well. So we're talking about balance. And when we look at cholesterol, we obviously know that cholesterol converts into pregnenolone, which cascades down to cortisol, aldosterone, and testosterone. So yes, we see in high testosterone levels a decrease in HDL and an increase in LDL. So again, it's about balance. HDL is the protein that takes cholesterol away from the cells, and LDL is the protein that takes cholesterol to the cells. What's it about? Balance. So yeah, it's not just the symptoms, it's also the clinical signs. And again, you must be under the care of somebody that knows what they're doing. So we talk about numbers, don't we? We want to be high normal, and my lizard brain still wants me to be high normal, but I don't actually feel good high normal. My libido drops. So why do I want to be high normal? It's absurd, isn't it? Because I'm a fan of excess, because that's my whole mentality. More, earn your reward. But when it comes to testosterone, you don't want to be high, because it's about balance. So I don't know, it's crazy, isn't it? When we're comparing natural levels and testosterone levels, we're comparing apples and oranges. So we've got a normal reference range, and I would say really a normal testosterone is between about 20 and 35, dependent on SHBG, and a normal free testosterone is between 0.5 and 1. Above 1, you can feel great temporarily, but then you're going to get dopamine downregulation, and then you're not going to feel so good. And you can see all these guys on the internet for years and years and years dialing in their protocols, changing substances. It's microdosing, daily test sip and HCG. And again, not everybody gets on with HCG, but that should be the first port of call, because it's HRT, hormone replacement therapy. So when we're comparing these apples and oranges, what are we saying here? Well, we're measuring in a trough, aren't we, when we measure on testosterone replacement therapy? And we're measuring in a peak early morning in a fasted state when we're measuring natural levels. So that makes sense, doesn't it? So you're trying to see how effective the HPG axis has been at producing testosterone overnight before exercise, nutrition, stress. All of these things impact your testosterone level. So diurnal pattern, day, night, day, night. So you're kind of comparing apples and oranges and say, well, I want to have a healthy testosterone on TRT. Well, what does that mean? Does that mean you should be aspiring to have high normal natural levels? It can, but we can see negative consequences as a result of being too high. So again, we know more isn't better. So you carefully balance and titrate your dose according to effect. But I want that anabolic effect. So if you've done steroids before, or you have an awareness of what you shouldn't do, you know, the first starter cycle is normally 500 milligrams of test a week, isn't it? And again, you're comparing that to a normal dose of TRT. It's massively different. So you're not going to get that massive anabolic effect that you're seeking from TRT. You are going to be able to achieve your genetic potential and perhaps surpass it, because rather than have an increase in testosterone and decrease in cortisol, and you're going to have the excess anabolic, excess catabolic, you're not going to have that kind of excess exercise that's actually paradoxically going to lower your testosterone or your ability to recover, because you're always anabolic. So again, we don't want to be high, we want to be normal, because we are human beings and our bodies survive on the concept of what? Balance. Homeostasis is an incredibly complex process whereby your body is constantly striving to maintain a stable internal state. So I want to be big, I want to be big. You can be as big as you can be. So look after what? Look after your sleep, look after your stress, look after your nutrition, look after your exercise. And again, don't take the path of least resistance, maximum reward, because there is no longevity in that, and it's all about sustainability. So my training has changed recently. 1 rep maxes, they are stupid, because they ultimately place your body under an extreme amount of stress. And it's not just your muscles, it's your ligaments, your tendons, it's your joints. And this whole system is incredibly complicated. So you're going for a 1 rep max. What's the point? To brag about it? Yeah, you're using that ego again, that stupid ego that's caused all this harm in the first place. Now, we don't want that, do we? Because you risk injury. It's now all about form and function. So 1 rep maxes. If something happens to your kid and it's under a car, or you hear these extreme situations of people having superhuman strengths, why does it take 6 coppers to withhold or to withstand one man who's pain in the bum? I'm just losing my train of thought just then. Why? Because essentially that guy, the perp, is concentrating inadvertently on his sympathetic system. So all we've got is excitatory neurotransmitters firing, because he's trying to escape capture. So he's stronger, paradoxically, than these six coppers who are having to use their brains and all of the other normal things, not go crazy on this guy. So you just think that autonomic nervous system can take over for you. So again, form and function. So what's it all about? Earning your reward, but earning your reward as long as you understand that the body survives on the concept of balance. You can push, but understand if you're going to push, you have to pull. So essentially, understand the need for